So as we move through today and this morning, as we talked about really having this not just be another conference or just another 5 CEUs, right? That we really take something away from this. And so be thinking about that, writing it down in your notebook or typing it on your computer or your iPad, but really grabbing hold of some of these things. There was so much in that, in Chris's story, but the one thing that I took out of that was that past and that future. I think we can often get caught up in our thoughts and thinking negative things, especially when working with adolescents, when working with youth. That the myth of they'll grow out of it, or they're never gonna get it. They're never gonna understand. Why does this keep on happening? Working in prevention and working in treatment and recovery, relapse, those types of things. But being able to put those in their categories and focus on that moment and be present. Thank you, Chris, for giving that to me and to us as well. And so we want to encourage you to continue that mindset into our next panel, which we're going to move into in just a couple minutes. Today would not happen, though, without our sponsors. And one of our gold level sponsors is Melrose Center. Nikki's going to come forward and share a little bit about Melrose Center here for just a couple minutes before we move into our next panel, which is collaboration. And so please welcome Nikki as she comes forward.
So what a great part to be here with you all. And oftentimes I've done things over the years with Know the Truth, and I find that a lot of times people are surprised that an eating disorder treatment program would be here. This is about substance abuse, right? So why would eating disorders show up? So I want to just start with, how many of you know someone who has experienced an eating disorder? Just with a raise of hands. Okay, quite a few of you. And those that didn't raise your hands, I don't know if you heard part of Caitlin's really inspiring story, but she shared about her eating disorders. And Caitlin, kudos to you for that, because it takes a lot of bravery to talk about that piece too. So I'm going to ask another question. I know we're kind of staying away from the statistics, but I think it's helpful for you to understand. So I'm going to ask everybody, just looking at the numbers here, I'm going to ask everybody in this section down below here to just stand up for a minute. Okay, so look around, and those of you that are still sitting, this is representative of the number of people that have a co-occurring eating disorder and substance use disorder. Okay, surprised? The numbers are pretty high. You can go ahead and sit down, thanks. Research would tell us about 25%, and it will go up to even 50% for those women who may be suffering from bulimia. So just wanted to have you have that little bit of understanding. At Melrose, we treat not only eating disorders, and that's all types of eating disorders, but we have a very specific program for treating co-occurring eating disorders and substance abuse. In each of your bags, you should have received a card about that, so you've got some information about that program. But I wanted to just spend a couple of minutes talking about how we do that. We have assembled an expert team of providers, from psychologists. You heard from one of them earlier in the earlier panel, Dr. Jason Reed. So psychologists and physicians, registered dietitians, nurses. We have a whole team of folks to address eating disorders. And they have experience not only in the eating disorder, but substance abuse as well as trauma. That's an underlying piece of much of this. So Melrose has been treating eating disorders for more than 30 years. We offer support, encouragement, and healing for people. And when I say people, we are treating kids as young as 6 and adults into their 80s. So this idea that while eating disorders may be starting at a younger stage, and it's just like substance abuse, it'll go away, they'll outgrow it. We have people in their 80s with an eating disorder. So it is something that can last a lifetime. It is the deadliest mental health illness there is. So the trick is to identify it early, intervene, and get them treatment. With treatment, there is hope. And today, some of you have already stopped by our booth and picked out buttons. I chose the hopeful button today because that is what I want you to know. There is hope and there is healing. And there are, like us at Melrose, places that you can go and receive that care. We offer treatment in 3 locations: St. Louis Park, St. Paul, and Maple Grove, probably the closest to this location. We're very specific in how we set up our site. They're intended to be welcoming and to provide an atmosphere of healing. We have healing gardens and a lot of meditation, chaplains, and everything that you were talking about earlier. That's a piece of this journey, not only for substance abuse, but for eating disorders as well. So mental health is clearly important to all of us, with 1 in 4 Americans experiencing mental health each year. And we're just thrilled to be a part of this day in this organization, and I just hope you'll continue to enjoy your learning. And no, I'll be out in the lobby for the rest of the day if you do have more questions. And I hope I piqued your interest just a bit on, wow, maybe you didn't know this connection, and to better understand that connection and to take action on it. So thank you.
Thank you very much, Nikki. Yeah, it was quite a few years ago we met and we started collaborating and working together on different parent awarenesses. But then we also had this idea at our treatment organization to bring their specialists in to train our staff on this issue, as we do deal with co-occurring disorders. And so that's also a resource, not to volunteer Nikki's time for her, but they do a lot of training and collaboration with other organizations. And so thank you so much, Melrose, for being a sponsor and really helping this event become what it is today. So we are going to move into our next panel, collaboration. So I'll invite the speakers to start coming up. And our moderator for this panel will be Patrice Salmari, who is the director of the Step Up program at Augsburg College. And so a same format of the first 2 panels, but the panel speakers can come up and we will get this underway. So please welcome the collaboration panel and Patrice. And Patrice. And Patrice. And Patrice. And Patrice.
Okay, so if you need to stand up, do whatever you need to do now. This is going to be an exciting panel. We have people from prevention, higher education, mental health, community, organization, and spirituality represented today. And it's my dream for all of us to be able to work together, to be in the same room with people from all different areas of life that touch a young person is actually something that I love to do. So, and of course, Chris. You have mics? Microphones? So today we're beginning to embrace a more holistic approach to prevention and treating of substance use disorders. It's becoming more and more important for parents and professionals to take a collaborative, supportive approach with our youth. This panel will discuss the vital importance of working together to develop effective strategies. So everybody, I'd like to give you about 2 or 3 minutes to introduce yourself and to answer the question, what does collaboration look like to you?
All right, I will start. My name is Lindsay Smith, and my title is Regional Alcohol, Tobacco, and Other Drug Prevention Coordinator. What that means, because it's quite a mouthful, is I work in the 7-county metro area. There are actually 6 other people that have my same position in greater Minnesota. But I work in the 7-county metro area doing essentially 2 things. First is supporting, providing resources and assistance to community coalitions that are working on substance use prevention. So doing a number of public health strategies as a community-based effort. And my other responsibility is kind of starting and gathering interest for building community coalitions in areas of the metro that doesn't already exist. So essentially, some people like to refer to us as brokers and connectors of information and resources on the topic of prevention and how community-wide, multiple sectors of the community can get involved in really making a huge impact. So I think that also then lends itself to answering the first question where we've been posed, which is, what does collaboration look like to me? It looks like bringing together, like I already said, multiple perspectives, multiple sectors of a community. So law enforcement, school personnel, businesses, media, youth themselves, parents, many of the people that we've already talked about or heard other panelists speak of today, bringing them together to really hear their perspectives, hear what information they have to bring to the table, what resources they have to bring to the table, and finding solutions together. So really what it is that we're here about today is how I view collaboration.
Thank you. My name is Lexi Reed Holtum. I am the Executive Director of the Steve Remler Hope Foundation, and I have the honor and privilege of working in collaboration with many of these people up on the panel, as well as many of you out there in the audience. I recognize a lot of you. Hi, Gloria. And so the Steve Remler Hope Foundation, well, let me back up. First of all, let me say that I am a person in long-term recovery. And what that means for me is that I have not had to use drugs or alcohol in 4 years, 361 days. So I only know that date because Monday will be 5 years for me. And being a person in long-term recovery affords me the ability to be executive director of the Steve Remler Hope Foundation and to create solutions in community and in government and across our nation. And to be able to work with some pretty outstanding people. You have one of my board members on your next panel, Dr. Chris Johnson. So the things that we do at the Steve Remler Hope Foundation to work in community are threefold. One, we do prescriber education. So we know it to be true that most prescribers are prescribing highly addictive substances to youth, to people of all ages, and that they have, if they're lucky, half a day's worth of education on addiction. So that's a void that we're filling. We are creating prescriber education, and we've partnered with the MMA and the University of Minnesota to produce these free CMEs for prescribers across our nation. Another thing that we do is advocacy, and that takes quite a bit of community collaboration. Things don't necessarily move in our country or in our state or on the tribal reservations when you expect it to come from top down. Each of you in here has to choose to participate. You've probably heard this before, but we are a constituency of consequence, but only if we stand up and show up, right? So, with our advocacy efforts, we work on the state and local and tribal and federal levels. We have our third program, which is overdose prevention. And again, that program takes quite a bit of collaboration, working with our first responders, working with our local governments, working with citizens themselves. One of the things, and I'm going to talk about that a little bit more later, but one of the things that I want to say about collaborating is I think one of the bigger breakdowns is just making sure that the communication is going out to everyone, right? Making sure that we're reaching everyone. Because there's a lot of little micro groups that work to get things done, and we're so much more powerful when we work together as a whole. So that's one of the things that I had to say in this intro moment. Thank you for having me.
My name is Sherry Gogler-Stewart, and I am the Director of Family and Spiritual Recovery for the Retreat. For those of you that may not know the Retreat, we are a facility that's steeped in 12-step recovery. We have residential programming, non-residential programming, older adult programming, and of course our family programming. And when I think about collaboration, of course, my immediate thought is to the family. How are we involving family in all of this? Stephanie Brown, who is the founder of the Stanford Alcohol Clinic, and she's the co-director there, or was the co-director of the Family Recovery Project, did a lot of research around family and recovery. And what she found is that there are 3 things that alcoholics and addicts need to have in place in order to have successful long-term recovery. Of course, that first thing is abstinence. You can't have recovery if you're still actively using. It's kind of the gimme in all of this. But if somebody has found a way to abstain, that's not enough. And you guys know that better than anybody. There needs to be a change that happens in somebody's life that allows them to continue to sustain their recovery. If those 2 things are in place, the one other piece that Stephanie found in her research that was important is if there's a family member in their own personal recovery as well. And that's often what gets missed. Our society is so focused on the fact that we need to have the people in our lives who are struggling with chemical dependency get help, that we often overlook what's happening with the family members. And if you send somebody away to a facility where they're getting assistance for their addiction, what's going to happen when they go home and nobody in the family has changed? They've done all of this hard work. They've done all of this looking deep within. They've done all of this preparation for heading on out home, and yet if you've got a family member or a family unit that's afraid of their loved one never finding recovery, and they're not getting support for themselves, that fear just turns into fear about them maintaining their recovery. And so oftentimes family members end up having the same exact reactions to their loved one, even though they're doing everything that they hoped would happen. And so I think that we need to look at collaboration, of course, on a variety of levels, but I think that the first place to start is what's happening within the family units. And as a family member in recovery myself, I have found that to be extremely beneficial in my life too. Thank you.
Thank you for having me. I am Dr. Misty Tu. I am the Behavioral Health Medical Director at Blue Cross Blue Shield, Minnesota. It's really fun to be here with this panel because we all have such different viewpoints. When I think about substance abuse and our substance abuse issue in this country, in this area, I look at it from a doctoral and a health plan perspective. And one of the things about collaboration that is so important is the sharing of information. I think that is something that we don't do well here. I, as a health plan, I have a lot of information. I know what doctors you're going to. I know what prescriptions you're filling. There are privacy laws and interpretation of privacy laws in this state where I can't share that information with you. I can't call Dr. A and say to Dr. B and tell him, your patient is seeing Dr. B and Dr. C, and they are getting the same prescriptions from different pharmacies all over the state. I'm not allowed to do that. I'm not allowed to tell you that your family member has a substance abuse problem, they are in danger, and they need some help. So I think that that is one thing that we globally need to work on together to change so that we can actually destigmatize substance abuse. This isn't something that we can't talk about. This is a disease, and it is something that we should be talking about, like diabetes or heart disease. You would tell your doctor if you had heart disease, it's okay to put that on a medical chart. Why is it not okay to put on a medical chart that I have an addiction? So we need to work on our privacy laws in this state so that we can actually share information so that people can get the best treatment possible. One of the other things that we really need to work on, I think, is from a medical standpoint, the 4 things we think about are prevention and education. Educating the patients, educating the families, educating our doctors. When I was trained in med school, pain was the 5th vital sign. And my job as a doctor was to make sure you left my office or the ER in no pain, no matter what it takes. That's what I was taught. That's where the problem started. Then we have people becoming addicted to pain medications. And when that runs out, becoming addicted to heroin and having really bad outcomes. So we need education with our medical schools. We need education with government surveys. I, as a doctor, patients get to survey me and say, did your doctor meet all your needs? Well, no, they didn't give me all my pain medications. So doctors have issues with not pleasing their patients. We need to work on prevention and education. We need to work on the treatment part of it. We need to work on the aftercare part of it. And we really need to get this information out there for people so that they can understand that there is a problem, there is something they can do about it, and they don't have to be ashamed about it. Thank you.
Thanks, Doctor. I really enjoyed the information sharing. For me, going on a speaking tour with my brother recently, going into high schools, going into middle schools, and speaking and getting vulnerable. Again, that's what really allowed me to get outside of my own self, and just, it's amazing how, that pain and that fear just dissipates right in front of me. I think mindfulness practices, and I think the education of some of this science backing, which is fascinating stuff, should be taught in schools early. I think we're so directed into gotta go get this. We're so focused on the outward. It's time to go inward. So I think the more that we can get into schools, obviously treatment centers, but get to the problem, get to the root before it even starts. It's so much unlearning that I had to do in my process that it's still a daily kind of reprieve. Just trying to get to the root of the layers upon layers, and I don't even know that there's layers in my consciousness at the moment until I'm able to get into a meditative state, visualize, my ideal self. So teachings on truth, getting this stuff into schools, I think is so important. Taking meditation, scientific stuff, taking this stuff into schools and allowing the kids to absorb this stuff and to get a certain amount of an emotional intelligence. I think IQ is a great thing, but emotional intelligence is what is really going to carry us through life, and that's what's going to be ultimately our joy and our peace. And so just to get to the solution and be proactive with it until it's too late, and there's so many resources available. It's just a matter of getting into these places and sharing the message and getting vulnerable and working as a team to collaborate the best solutions in the schools to get their minds able to focus inward and to be able to dissect those problems inside until they manifest themselves on the outside. So in the Western states, we're so keen on going outside, but I think just focusing in on finding the light from within and then just sharing that light from our own experience.
Thank you. We're focusing in on the importance of a multi-systemic approach, and all of you have spoken to that. But what do you think are some of the roadblocks and challenges that hinder collaborations when working with youth?
Go ahead.
I can begin by just saying I think engaging youth is sometimes a challenge when we're talking about organizations and adults that all come together to collaborate on something that we all think we know how to do oftentimes. Taking into mind when youth are available to be a part of that conversation sometimes gets overlooked. I've also been in many rooms where youth are present but aren't sure how to have their voice heard or aren't comfortable speaking up. So sometimes it becomes just making sure to keep in mind that we're asking them the questions, we're asking them to participate in the conversation. A panelist, I think in the first panel from Kennebec County, if I'm remembering that correctly, was referencing how their coalition is doing a great job of bringing youth to the table and allowing them to, in their own group, do a lot of work with their peers and then come back and report it to their larger group of that kind of cross-sector representation of the community. And I think that's an amazing format to involve youth in this kind of process of coming up with solutions. I think the key is making sure to remember that they sometimes need to be shown the platform and shown the way for how to have their voice heard.
For me, will you repeat the question one more? So
Yeah, what are some of the roadblocks or challenges that hinder collaboration when working with young people?
I think just the lack of the lack of truth that's out there, the lack of education in terms of being able to go inward. It's just not out there. It's just not spoken of from the schools, at least that I've been to. So I think having access to get into schools and start that process is a huge roadblock, and just, I guess, just the patience. And I really like your answer, because it is something that is foreign, and it's just going to take a little bit of time for some of this stuff to really grow root. But I think planting these seeds early on is the way to go. It's just a matter of being able to get into some of these places to share this information. There's a manual that we're working on at this Quantum Revolution. That's basically, it's called Hope is Dope, and it teaches kids and people in recovery how to access pleasure centers in the brain without having to use drugs and alcohol, to access those centers. And it's fun, it's things that they can do, on the daily basis that really mimic that same feeling. But if we can get those feelings in place now, they won't be searching for those later on. They'll be fulfilled. And again, from my own experience, it was that always uncomfortability that I was feeling that really kept me from feeling at peace. So I was always trying to search for it outward. So if I can get those lessons and those meditative practices done early, it'll be a great help.
Okay, so if you need to, close your eyes, and that way you'll think that no one's looking at you, because your eyes are closed. Can I see a show of hands of those of you that have a young person in your life who has the disease of addiction, please? Okay. Can I, of you all, how many of you would have said, not my kid? How many of you would have said, not my kid? Okay. So I would pose that the biggest problem to working in collaboration with young people is their parents. Because what we have going on in our society, and I've heard up here on this panel today, and sorry I wasn't here this morning because I know I missed some fantastic speaking, and I look forward to watching the video. But what I know to be true is that pretty much 90% of the people that I talk to who have a young person that they love that is actively addicted to drugs and alcohol, that has the disease, would say, not my kid. It's not going to be my kid. My kid would never do that. And so that's maybe the biggest part of the problem to collaborating, is that we still have a society, as well-intended as it is for us to say it's a disease, let's treat it like a disease, there's a tremendous amount of fear around actually doing that. That's why when I speak anywhere, I say, I'm a person in long-term recovery. So you can start to identify what a person with the disease of addiction looks like. It's me. We're everywhere. We are everywhere. There is no socioeconomic class in our country that is not impacted by the disease of addiction. So the first thing I think we need to do and address is starting to have parents accept the fact that this is a disease just like diabetes or cancer, and we need to treat it like that. But to be able to do that, you have to say, yeah, it could be my kid. When we try to go into schools and talk about opioids and talk about that, I have a 13-year-old who just finished her first section of health class. And they did not talk about prescription opioids. My daughter came home and she's truly upset because this is what I do for a living and because we lost someone that we loved. And they're not talking about it, and it's the #1 cause of accidental death in our country today is prescriptions. So we think as adults that our children and ourselves are safe when we take things that are prescribed to us. But again, doctors do not have the education that they need to be aware of what the disease of addiction looks like. So that would be, I believe, the biggest barrier to having conversations around creating solutions, is just the not my kid, not my family, not my community.
Thank you.
There are several trains of thought running through my head. And the first is that I do think that denial can definitely play a part in all of this. I sure can, thank you. I believe that denial can play a part in all of this. Denial that the problem is as bad as it is. Denial that if a situation would just change, maybe everything would be okay. But I want to branch out a little further than parenting, because I think that parents do the best they can with what they have at the time. And I think that part of the issue is lack of resources. There was a time where there was a school counselor in every school who was a chemical dependency counselor that was meeting with kids, that was watching what was going on with kids, that was dealing with kids who were not having their own problem but growing up in an addicted family system, and that doesn't happen anymore. The funding has been cut, those positions are gone. There is also a lack of education in our medical community and understanding the disease. I have a wonderful, wonderful primary care physician. And every time I go to see my doctor, she knows what I do for a living, so she wants to talk about alcoholism and addiction, and she doesn't get it. She has a loved one who struggles, and she just wants them to stop, as we all do. But with the thought process of, well, they should just stop, that creates that air of denial. I also see it in the surveys that you take at the doctor's office, where they ask you about mental health issues, they ask you about depression, they ask you if you've had a substance abuse issue, but they never ask you if you're living with somebody who's struggling with substance abuse, where they're not looking at that level of reason that there might be depression going on. So I think that there is an important thing that's happening with our society, and the society being so focused on the fact that if our loved one gets help, everything will be okay. That is what is helping to create the denial that's happening systematically around all of this. And I also believe that the system is creating a belief that, well, there's just such a huge stigma where alcoholism and addiction is concerned. Even though, gosh, when was alcoholism first declared as a disease by the American Medical Association? Wasn't it like 1955? And yet we still live in a society that wants to believe that if you just pick yourself up by the bootstraps, everything will be okay. Yep. And it's not the truth. We need to move beyond the stigma, because I really believe that part of what creates denial in this system is shame. Shame that we must have done something wrong to help contribute to this, and getting through that shame in order to do something that's helpful is a really difficult thing to do, especially if there's no resources to support you.
So first of all, I would like to say that I believe that our youth are exposed to more danger than they ever have been in the past from this arena, because the medicine is prescribed by a doctor. You know, they prescribed Johnny Adderall, and Johnny brought it to school. Why can't I take a few? Why can't I take a few Vicodin from grandma? You know, it's prescribed by a doctor. It must be safe. And then we have synthetic drugs. So we have medicalized marijuana. We have bath salts in the community. We have spice. We have things that are legal and that we try to make illegal, but every time we try to do that, the manufacturers change the synthetic compound of the drug just enough so that it's still legal. So if you go out and use spice, which is a synthetic marijuana, it binds 4 to 100 times more stronger to your brain than regular marijuana does. 4 to 100 times. You have no idea what dosage is going on in your mind. That's why people are getting really, really sick. I had a patient come in to me several years ago when I was still practicing in a crisis center, and he was recovering from amphetamines. He saw an ad in a smoke shop newspaper for bath salts. He went out and decided, I'll do bath salts because it's legal. And he became so scared and paranoid and was hallucinating so badly, he took a reciprocal saw and tried to cut off his head. Fortunately, he did not succeed. He was able to get medical care, and I was able to treat him. But these are the type of things our youth are dealing with, so there's danger out there. So I'm really glad things like this are coming to light. What I would say is the biggest barrier is simply what I said in my intro. I have a lot of information. Why can't I give somebody that information? Why can't I give the families, the doctors that are prescribing, the pharmacies that are handing out these medications, why can't I give them that information? I think that is my biggest barrier to collaboration and to trying to keep our youth safe and our adults.
Let me ask you another question. What are the positive and negative ripple effects of well-intended collaboration?
Ripple effects?
Yeah, positive and negative ripple effects of well-intended collaboration. I mean, we don't want to do the blame game. You know, we believe that everybody's acting in good intentions. The schools are acting, the parents are acting, doctors are acting, hopefully in good intentions. But what happens when there are ripple effects of well-intended collaboration and then the negative ripple effects of collaboration?
Well, I think with the positive, you know, I mean, for me, truth is truth. So I feel that, you know, in my core being. And, you know, it's like this light that is shining in my face that I can't stop looking at. You know, it just, it draws me into it, you know. I think, you know, by us staying in love, by staying in acceptance for ourselves, and I love the comment on the family aspect of, that's the ripple effect down the generations. But from what I experienced just on these last couple of little tours that I've been on, it's the parents that are having the issues with the drugs. It's not always the kids. And so, you know, for me, and just with my parents, teaching them meditation and stuff, I find that the conditioning is even more set in stone to where new ideas are hard to come through, you know. So it's, again, it's an unlearning of those things, so it can take root earlier on in life to get proactive rather than reactive. And I think, you know, it goes with the negative ripple, you know. I mean, if people are being taught things that aren't necessarily truth, and they're being, you know, for example, that we're all connected, you know, through entanglement. And if someone's coming into a situation of fear, you know, for their kid, which what parent wouldn't, you know? I mean, I felt that deeply with my mom, you know, dealing that with me. And ultimately, that's going to keep me more stuck in that situation, and it's going to perpetuate the problem even more. So education in terms of that is huge, because holding the space of love and acceptance, you know, plays a huge role on the person that you're in direct contact with. And that ripple effect is massive, you know, because it just keeps getting passed along. So just have light, hold light, and pass it along, and the ripple will go.
Anybody else?
Thank you. So this is actually a really timely question for me. We at Blue Cross Blue Shield are working right now on a pilot to really embed some mental health and substance abuse help into primary care clinics for our youth, because we know that's the doctor that they're going to go see. So how do we start having that conversation and then give the doctor the tools to address it when they say, yes, I have a problem with substance abuse, or yes, I'm thinking about trying marijuana. Do you know that we actually have some studies and evidence that can predict a child's risk of using substances before they even begin using? Impulsivity, antisocial behaviors, oppositional defiance, those types of things have been identified to be risk factors for potential substance abuse in the future. And yes, there are treatments that we can try. Therapy, group therapy, empathy training, there are things that we can do. So it's a really exciting time for us and a project that we are really trying to get off the ground. What I would say that the challenge to it and in the collaboration is perfect being the enemy of good enough. Because we want everything perfect. We want all of the data. We want everything to go well. We want all of the codes in place. We want, we want so much from this. But at some point, we know we're just going to have to launch. I have to be able to prove to my stakeholders that this is financially viable and, of course, good healthcare outcomes, which is what we all strive for. So I want to make sure this project is successful. So it's a really interesting thing. Obviously, we don't want to get to the point where physicians can't prescribe. If your child has ADHD, your child needs to be treated for ADHD. If you have knee surgery, you're probably going to want an opiate. But there are many things that we can do. We can do things such as we are looking at other Blues plans right now. Some of them have limits on acute pain meds. So instead of 30 days of medication, we're only going to dispense 7 days at a time. And after you use that 7 days, then let's see if you need some more. Because after about 7 days, you start running into physiological addiction. So these are some of the things we're thinking about. The ripple effects are, though, you probably don't want to go to your pharmacist every week. You probably don't want to have more PAs on your medications. We understand that. So these are kind of the barriers and challenges that we face, is trying to make things safer and better, but not putting roadblocks to people with actual pain and issues that need to be treated.
Well said, Doctor. Thank you.
When I think about the things that families do, well, the things that any of us do, I think it's all very well-intentioned. I don't think any of us get up in the morning and think, gosh, how can I make this worse for my loved one? It's just, that is not our primary thought. And yet, there are the things that we do with the best of intentions that aren't helpful. How many families have I worked with who have stayed up late worrying and have covered up for their loved ones' mistakes and have taken on their responsibilities, and they've footed a lot of bills, and that hasn't changed the outcome of what's going on with their loved one. So I definitely believe that there's an opportunity for greater support and greater education in all of this about what is actually helpful. You know, one of the things that we talk about in our family program is helping families move from reaction to response. When we are frightened, and for those of us that love somebody who's actively using, we are frightened a lot of the time. If we're letting that fear drive all of our behaviors, we are part of the problem. Mm-hmm. And so how do we find a way to take care of ourselves so that family members can start choosing how to respond to all of this instead? Looking at what their motivation is behind their behaviors, learning the things that might actually be helpful, learning more about the truth about what they're up against with the disease. I think that oftentimes family members understand intellectually that this is a disease, but their emotions haven't caught up. So how do we actually create space, a safe place for families to really learn the truth about this so that they know what they're up against and so they can show up differently in that collaboration process?
Great. I'm going to do another question. How's
Good.
that?
Yes,
Okay.
please do another question.
Everybody here knows that our young people are the most creative, brilliant people you'll ever meet. They are the future. What do we need to do, and how can we better work together to develop effective solutions for our young people?
Okay.
Feel free to text your questions in as we're doing this.
Can you summarize that again?
How can we better work together to develop effective solutions for youth? All of us. How
Okay.
can we better work together?
All right. So, okay. I think that we need to start at two ends. I think that when we come together to work to create solutions, we need to stand where we really are, which is we're facing a massive epidemic of overdose death. So we need to look at that component, solve those problems by being honest about it, by getting everybody the tools they need to prevent the death so that that person can stay alive long enough to get into active recovery, to then become a person who's working in society in a positive manner. I think also what we can do for our youth is starting at the other end. We've got to create the educational components and put into place the systems that we need to have our youth educated. How many people in here remember when we didn't talk about safe sex? Okay, yeah, right? Well, that wasn't really working for our society because people were still having sex. And so young people were. And just like not talking about it didn't solve the problem. So we need to talk about it to our 11, 12, 13-year-olds before they get into that peer group where there's pressure and they start to use because of that pressure. I saw some smiles over there. Okay. So talking about it on the front, creating the solutions on the front end, creating the solutions on the tail end, and then standing in the middle. Another thing I think that we need to do is remember, for those of us that have been doing this for a while, remind ourselves that it's okay to let people in with new ideas and new solutions, and then to more quickly remedy the unintended consequences, to stop waiting so long to create the solutions, like, for example, with the PMP. You know, we now know that doctors are utilizing the PMP, but they're kicking people out of their clinics, but they're not titrating them down off of medications. So they're essentially leaving them in a vulnerable place where they're still actively addicted and they no longer have a source for their meds, so they're going to the street. And these are our young people who are being prescribed for a broken arm 70 oxys. So that is an issue. And so, okay, so being honest, creating solutions, be willing to take quicker action. Thank you.
So I have a couple of thoughts running through my mind. Some to piggyback off of what Lexi just said. A colleague of mine likes to say that people support what it is they helped create. So it kind of piggybacks off of what you just said of those of us who really care passionately about these issues, those of us who have been doing it a long time, we may come to the table and feel that we know what the solutions are, but coming to the table in a sense of an openness to listening is hugely important when we're talking about collaboration and how we can find unique solutions. A thought I was having related to the other question asked of what are some of the positive ripple effects of collaboration, it's that innovation comes from it. That's a huge reason why the folks that I work with in community coalitions, that's why they're almost mandated by some of their funding sources to bring that many perspectives together. They're looking for innovative solutions, not the things we've been doing for years and years and years that aren't satisfactory to us at this point. The other thing I want to say related to effective solutions is how important data-driven solutions are. How so often I think it's just human nature to want to do something. And we forget about really analyzing what the problem looks like. What is it? What is it that we really need to look at? What components are really important? What are the trends? What are all of those things? For anybody who's a data geek in the room, you'll hear me. But for those of us who aren't that comfortable with looking at data, it's still very important in helping guide and drive what it is that we're going to spend great amounts of time and money figuring out as an effective strategy. With that, then, the other piece I want to add in is so much of this is systemic. Other panelists have talked about that as well. the effective solutions that we need to be looking at when bringing big collaboration together goes beyond educating everybody. Education is very important, but we really need to be looking at what the systemic issues are, what's the root cause of these problems, and how can we intervene there. I, again, come from a prevention standpoint, and so I'm really looking at and believe strongly in its value of really understanding how do we cut it off right at the base, while, like Lexi said, also supporting those who are facing and looking into treatment and recovery. How at the same time do we work on some of these systemic issues? And that is really, for me, where the value of bringing people from all sectors of the community together comes in. So that, once again, we can help everybody understand what their vested interest is in it. Because I think a lot of times people aren't at the table because they don't know. Nobody's told them why they should care about this issue. So those of us who are in the room here today need to be thinking about that too. If you want a partner at the table, you better tell them, and you better tell them why they care, because they probably already have a vested interest. It just hasn't been highlighted for them.
Thank you. Some questions that are coming in for everybody. Marginalized populations have few, if any, resources, and we often have to refer to programs that create language barriers for parents to be involved. How can we better support these populations?
So that's a really important question because we have a very diverse community here in Minnesota. And we're diversifying across the U.S. So we know that culture is really important, and what we have found and what we're doing at Blue Cross Blue Shield is working on a health equity strategy, because we found that most organizations, and probably where we are, is in a state of minimization. We acknowledge the differences and we kind of think they're cool, but we think that we're more the same than we are different. So we don't look at the adaptation. What are the cultural strengths that you bring into this? So we're really looking at how to incorporate those into treatment, into our philosophy. So we look to diversify our employee group. We look to bring in outside stakeholders and really in-depthly engage in what are your differences and what do those differences mean to you, and how do we bring those forward into a way that your community will be comfortable engaging with us in your treatment.
Thank you.
Another thing too is because I have the honor and privilege of going into a lot of communities. Like yesterday and the day before, I was at White Earth Reservation. So one of the things that's really, really important to remember, and you taught me this in class once, is that when you go into a new community that is not your ethnic community, to make sure that you give room for them to actually tell their story. You know, allow them that humanness of telling their story, because one of the biggest barriers also to collaborating and with the diversity of group, and I have to say, the more diverse your group is, the more powerful you are. Because that diversity of opinions, that differences are strengths. And we need to sit in those strengths and be able to be mature enough to hear somebody else's point of view and not kind of, for lack of better words, have a hissy fit, right? And calm down enough to listen. But allowing the other person, allowing that other group to share their story with you and giving them equal power at the table is really key.
Thank you. Another question. I want to just make a statement about that. The difference between equality and equity. So when people have an equal say at the table, are they also getting equitable opportunities to engage? Because that's very important. Question. There's lots of focus on providers collaborating. Have there been discussions on having youth involved in the collaboration process, and what are the outcomes? I can speak from my experience. Young People in Recovery, YPR, is an organization that's nationwide. They have a training coming up next week, a webinar on the 19th. And that's a great venue for people to express who they are, to tell their stories, to influence advocacy areas. They've had a lot of influence in the Rally for Recovery last year in DC. But the other organizations, there's recovery high schools in the room, there's collegiate recovery programs in the room. These students have a chance to collaborate on levels, but I'd like to see them engage with us too on all the things we're talking about today. What's the youth input? So I'll turn it over to you. What's the rooms, where's the space for young people to be involved in the collaboration?
I can't speak from the understanding of having kids who are struggling with their own addiction in the collaboration from my own experience with our family program, but I do want to speak to the youth that are having their own experience in recovery, either children of alcoholics or addicts or siblings of alcoholics or addicts. One of the things that we've done at the retreat is offer programming for 7 to 12-year-olds, having kids camps for kids that are impacted by this disease so that they can find their own recovery in all of this. And with our family program, we welcome anybody who's 12 years old and older to come and be with the adults in the family program because they acclimate so very well with the adults, and what I know is that they know more than what we think they know. And to give them an opportunity to sit with the adults and speak their truth and get some affirmation about what their experience has been like is really very powerful for them. And I think it plays into the prevention piece that we talked about here this weekend, this afternoon. There's pieces of research that shows that if we are sharing with kids about recovery, we're letting them know that there might be a family history of all of this. We're letting them get actively involved in their own recovery. It pushes back the average age of first use, and we know that pushing that back also helps to have fewer long-term issues with alcoholism and addiction as well. So there's research supporting that. So again, I can't speak specifically to the child that may be having their own substance abuse issue, but with my work with the youngsters that are impacted by that, there's a lot of help and a lot of support that comes in that collaboration.
Thank you very much. There are a lot of questions that came in for Dr. Tu. So are you going to be around a little bit afterwards that people can ask a little bit of questions? Sure. Because we're out of time right now. So lots of insurance questions for you. Okay?
Fun. Yay.
But I just want to thank the panel for participating and the idea of collaboration. And thank you very much for your questions.